Welcome future nurses to LPN LaunchPad's review on cultural considerations in nursing. This review will explore how understanding and addressing cultural diversity can improve patient care and outcomes. Why does cultural competence matter in nursing? Providing equitable care builds trust and rapport with patients. It leads to better health outcomes and ensures that each patient feels respected and valued. The goal is holistic, individualized care that meets the unique needs of every patient. Cultural competence involves recognizing and respecting the diverse cultural backgrounds of patients, integrating cultural knowledge into every aspect of patient care, and ensuring respect and dignity is part of every patient's treatment. To practice cultural competence effectively, nurses need awareness of their biases, cultural differences, and the skills to communicate across cultures. Each patient encounter is an opportunity to learn and grow in cultural understanding. Barriers such as ethnocentrism, stereotyping, and communication challenges can hinder culturally competent care. Overcoming these requires self awareness and a commitment to understanding and respecting differences. Ethnocentrism, the belief that one's culture is superior, can limit nurses' ability to provide quality care. Reflecting on personal biases, valuing diversity, and educating oneself about other cultural norms are key steps to overcoming this barrier. Every patient is an individual. Avoid assumptions based on appearance or background. Instead, ask open ended questions to understand each patient's preferences and needs. This approach ensures care is personalized and respectful. Transcultural nursing is a specialized field that focuses on delivering culturally appropriate care. It integrates knowledge of diverse cultural practices into nursing care, ensuring the nurse meets the patient's holistic needs. Understanding transcultural nursing can enhance patient outcomes and reduce health disparities. Nurses can achieve this by educating themselves about cultural dynamics and engaging with local communities to understand the populations they serve better. Language barriers, nonverbal cues, and communication styles can impact care. Using professional interpreters, validating understanding, and respecting diverse communication norms are critical strategies for success. Cultural beliefs influence health practices, dietary preferences, and even perceptions of time. By understanding and respecting these influences, nurses can provide care that aligns with patient values and needs. Personal space preferences vary greatly. While proximity may signify warmth in some cultures, it may feel intrusive in others. Nurses should always be sensitive to cues and seek permission before engaging in physical contact. In many cultures, families play a central role in healthcare decisions. Identifying and involving key decision makers in care discussions fosters trust and supports better outcomes. Religious beliefs can shape patient preferences, from treatment options to rituals. Nurses should show respect and collaborate with chaplains or spiritual advisors when needed, ensuring holistic care. Cultural assessment tools such as the Purnell model and the Giger and David Heiser model provide frameworks for understanding and addressing a patient's cultural needs. The Purnell model offers a holistic approach to cultural assessment, addressing family roles, communication, and health behaviors. It provides comprehensive insights into a patient's background. The Geiger and David Azar model focuses on communication styles, time orientation, and social structures. Addressing these critical factors helps nurses adapt care to align with specific cultural contexts. It helps nurses adapt care to align with specific cultural contexts. Cultural safety means creating environments where patients feel respected and valued. Addressing institutional biases and empowering patients to express their cultural needs are vital steps. Cultural competence is a lifelong journey. Nurses should attend workshops, engage with diverse communities, and stay informed about changing demographics to serve their patients better. When preparing for the NCLEX, it is important to recognize patient preferences, use professional interpreters, and respect dietary and religious practices. Always focus on providing individualized, culturally appropriate care. Here is a sample question. A patient avoids direct eye contact during a conversation. What should the nurse do? Options include A. Assume the patient is not listening. B. Recognize this may be a cultural norm. C. Establish dominance in the interaction. D. Conclude the patient is disrespectful. The correct answer is B. Recognize this may be a cultural norm. Avoiding assumptions and considering cultural influences on behavior ensures respectful and effective care. Another question. A family requests the inclusion of traditional healing practices in a care plan. What is the best response? Options are A. Explain that hospital policy prohibits alternative practices. B. Assess compatibility with prescribed treatments. C. Ignore the request as it conflicts with medical protocols. D. Suggest focusing solely on Western medicine. The correct answer is B. Assess compatibility with prescribed treatments. Respecting cultural practices while ensuring safety supports holistic and patient centered care. In conclusion, cultural competence is essential for equitable, individualized care. Overcoming barriers such as stereotypes and biases, and utilizing tools in education strengthens nursing practices and patient outcomes.
Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.